Hello and welcome to our special COVID-19 update. I am Ladi Akeredoluale. Here are the highlights at this hour. Federal government confirms Nigeria's collaboration with the WHO on clinical trials. Lagos State Incident Commander Babajide Sanwo-Olu talks up additional facilities for holding returnees for quarantine. And death toll continues to climb across the United Kingdom, the United States, and France. We begin tonight from Lagos, where as the debate on the right drugs to treat the new coronavirus COVID-19 continues, the Minister of Health, Dr. Osagie Ohanire, today revealed that Nigeria is one of the countries working with the World Health Organization's clinical trials on the treatment of the disease. Speaking during the Presidential Task Force on COVID-19 briefing, Dr. Ohanire said the state's Commissioner for Health, Professor Aki Abayomi, is leading the efforts in Nigeria to participate in the trials. He, however, reiterated that no treatment has been recommended by the WHO at this time.
Coronavirus, as you know, is described as a novel virus. A novel virus means that it's new, and the medicines that might work against it are not yet very clear. So different trials are going on in various places. People are trying all sorts of methods, and part of what you said just now is being tried, the use of convalescent plasma, which is taken from people who have had the coronavirus, they have been treated successfully. So you can take their plasma and see if you can use it for other people who are seriously ill. These are still trials that are still being reviewed and will be confirmed as time goes on. The same goes for chloroquine. Chloroquine has been found in some tests to work outside the body, what you call in vitro testing. But if you take it inside, if you swallow it and take it, whether it really works the same way as it works outside in a test tube, if it works in the test tube as well as it does outside, it's not yet very clear. Most of the countries in this world depend on the declaration from the World Health Organization, because the World Health Organization collates all this research and studies them and then makes a recommendation for countries to take. We also look at the World Health Organization, and we are joining in some of the studies that World Health Organization is organizing here in Lagos. The Honorable Commissioner of Health is doing all he can to participate in the trials, clinical trials for convalescent plasma and chloroquine, hydroxychloroquine, and the azithromycin that is being used in France.
Dr. Osagie Ohanire, Health Minister. Well, you know by now that a total of 32 patients have been discharged from the Lagos Isolation Center in Yaba after testing negative to coronavirus. And the state government has revealed that it has centers in border towns and across the state to hold people just returning to the country using the land borders. The Lagos State Governor, Babajide Sanwo-Olu, confirmed this today, saying these facilities are put in place to prevent the spread of the virus in the state.
We have other facilities that were also reserved in the event that we need to trigger the usage of those facilities. An example is, so when we have people coming from the land border, right, and there was a request about yesterday about some people coming from the land border, and we needed to activate a facility at Badagry. So we have two facilities at Badagry, right? So when that happens, those facilities will go live, right? So we also have facilities in Ekpe, we have at Alimo Shore, we have in Lekki, we have in other places that are just waiting in the event that we need to activate and clear those facilities, especially for quarantine. If we need to just hold people for 14 days, we don't know their status, or just, we're not sure if it will manifest or not. So just to hold you down and see how you evolve, because it's not every case that you need to take to a red zone in the isolation center. You need to have what we call like a holding bay, and so those are the kind of facilities that we've also made available for them.
Lagos State Governor Babajide Sanwo-Olu. Now, joining us via Skype from Lekki in Lagos is Dr. Tunji Funshaw, who is a consultant physician and cardiologist. Thank you very much, Doc, for joining us on this special COVID-19 program at this hour. Now, the people defined the lockdown in some areas right across the country. What's your view about how well they were sensitized on why they should follow the government's directive on curbing COVID-19 in Niger?
Thank you very much for having me. Good evening. I think sensitizing people, particularly in something that is hitting you for the first time, can be a very difficult undertaking. I will score the government high as far as sensitization is concerned. Apart from the government, there are quite a number of voluntary organizations who have stepped into the ring and did their bit to sensitize people. It's an ongoing thing. It is almost impossible to reach everybody at the same rate at the same time. I think the government can do a little bit more, particularly in the areas of speaking to people in the kind of languages they understand. Perhaps we need to break this thing down to the level that people understand. But so far, I think they're not doing a bad job.
Now, other campaigns have taken place for other kinds of scourges or crises that hit the country. I mean, if you take, for example, the campaign strategy on polio that was employed in various parts of the country when polio was a crisis for Nigeria. Do you think some of those campaign strategies could be adopted to get the message on COVID-19 across to the people you spoke about in your answer to the earlier question?
Yes, I think they should. Having been involved with the polio campaign for almost a decade, we've employed a lot of strategies, and strategies will have to be based on the environment in which you're operating. We use jingles, we use drama, we also use local comedians, and also using celebrities as well. And I think I've seen quite a few of those being applied to the COVID-19 outbreak in terms of sensitizing the community.
But if you take a look at what is happening countrywide, in some places, the restrictions, the lockdown, if you prefer that phrase, is being relaxed, while in some other places is being tightened. So overall, do you think in that kind of situation, the objective of the various restrictions can be brought to bear if it's not uniform across board?
If it is not uniform across board, it's going to be very difficult, to curtail the spread. The thing about the virus is that it has no legs, it has no hands, and it only moves when humans move. So if you do not, create a situation where the movement of humans is limited to the barest minimum. In our own case, the lockdown, has just a few exceptions. If it is not uniform across the country, if people are still able to move across borders, then the chances, that we'll get, a much more exponential increase in number of cases is going to happen. I believe that we need to come together as a nation and unify against a common enemy. This is not the time for division. We should all put, our heads together and ensure that this virus does not defeat us. We cannot afford it because of the state of our healthcare system. We cannot afford to be overburdened, by sick people because we fail to take a very, very simple basic measure of staying at home or for the governments to take the leadership in this regard. I know there are difficulties with people staying at home, but if everybody takes responsibility and do the best they can to keep away from people and keep other people away from them, I think we'll be able to limit the spread of the infection.
Now, going forward, all kinds of interesting things are being said about how this can be combated. I'm talking about the virus itself. I mean, if you get it, what the things that need to be immediately done in terms of treatment, how you can go about surviving. You're a cardiologist, and amongst other things, the organs that you are a specialist in are affected by this if it becomes something really serious. So what can you tell us about what needs to be done when or if people find themselves in this situation?
Well, I think the first thing is, and I think, we're not doing a bad job on educating the public about what the symptoms to look out for are. Essentially, the fever, the cough, myalgia, which is, aches and pains, in your muscles. Quite occasionally, people can get a diarrhea as a consequence, of the COVID-19 infection. Now, if you get serious, of course, the flu symptoms is quite common also. If you get those kind of symptoms, there are numbers you can call that should be able to respond, to you, and will determine, what the next step should be. The Nigerian Center for Disease Control, I think, has done a reasonably good job in informing the public about what the symptoms are. WHO is doing a lot of work. My organization, Rotary International, is also doing a lot of enlightenment campaign to avail the public of what the symptoms are. And once you have those symptoms, the smartest thing to do is to get in touch with those numbers. And usually somebody will come to your aid and tell you what to do. Depending on your symptoms, you may be advised as what you need to do, or you may now be tested. If you're tested and you're found positive, at least I know in Lagos State, you'll be taken to one of the centers that have been set aside for that purpose. And the physicians who are running those centers will determine, based on what you present with, what your treatment should be.
All right, thank you very much, Dr. Tuji Funshaw, a consultant physician and cardiologist who joined us from Lekki in Lagos. Thank you so much for your time.
Thank you.
Now, let's take a situation update from other parts of the country. First, we go to Minna in Niger State, where earlier our correspondent on ground there, Emperor Simon, sent in this update.
No confirmed case of COVID-19 in Niger State, but the state government is not resting on its oars to tackle any possible outbreak. The chairman of the Niger State Task Force on COVID-19 and secretary to the state government, Ahmed Matani, has said 12 new points have been identified for the establishment of isolation centers, in addition to the existing one at the Minna General Hospital. He has also warned that anyone caught contravening the restriction order by the state government risks possible jail term. To meet up demands for hand sanitizers and other consumables, experts have been engaged by the state government and the Niger State Drug and Hospital Consumables Management Agency for the production of the item.
Any person who fails to comply with a restriction, prohibition or requirement imposed under this order, or do anything contrary to the provision of this order shall be liable to a fine or imprisonment, or both fine and imprisonment, in accordance with the extant laws.
These efforts, the state government believes, would help in building its capacity to handle any kind of outbreak that might occur. From Minna, the Niger State capital, Emperor Simon.
Thank you very much, Emperor, in Niger State. And from Niger State, we'll move to the Federal Capital Territory in Abuja, where our correspondent Ibrahim Adra joins us from our Abuja studios. Now, Ibrahim, if we do have indications on some platforms that some form of relaxation has been introduced to the curfew or the lockdown in Abuja, are you able to confirm this at all? For example, it is said that market days have now been introduced, Mondays, Wednesdays, and Saturdays, when people can actually go out and pick up essentials from the market. Is this true?
Well, you're right on the last count, Lady. Yes, indeed, markets would now, and let's get this clear from the outset, not markets. You recall the Presidential Task Force in its guideline when it was reeling out, it said only those shop and stores that sell consumables, food items and groceries are to open between 10 in the morning and 2 in the afternoon. So essentially, this is what this is all about. It's simply that the FCT management sat down together with the authorities of the markets and security agencies in the FCT and agreed that they are going to implement this guideline to the latter. And so you recall the Presidential Task Force did say that these markets, as it were, 10 to 2 for grocery shops would work on alternate days or even less frequently. So what they have agreed right now is that, yes, they will hold Mondays, Wednesdays, and Saturdays only between 10 and 2. So this is in no way relaxing the lockdown in the city.
Now, talking about the general compliance level, what's the update on that?
Oh, well, that appears to be going very well, if you ask me, in the city center. Largely, compliance has improved. The security agencies are doing a very good job. They are at strategic places all across the city center, flagging down anyone who dares to come to pass through, and you'll have to give a very good reason why you are out on the road for them to allow you go. Again, we must note that they have been very courteous. I mean, the interactions you see at such points are such that you're delighted and you're proud of the Nigerian police and other security agencies for what they are doing. But of course, you've got to explain why you're on the road and why you should be allowed to go through in any of these places.
Now, finally, we hear that the Humanitarian Affairs Minister, Sadia Umar Farouk, who was not with the Presidential Task Force, of which she is a member, on their trip to Lagos, spent the better part of the day at the National Assembly. What can you tell us about that?
Well, that's true. I guess that meeting was called at the instance of the leadership of the National Assembly. And I say National Assembly, now it means the Senate and the House of Reps together. Ostensibly, what is at stake is the palliatives and the federal government is rolling out to cushion the effect of COVID-19, its impact on the people. So our correspondent Linda covered that story for us, but what is coming out from that place is that the leadership of the National Assembly is not satisfied with the methods of reaching out to the poor or determining who the poor and vulnerable are as far as the distribution is concerned. I guess that's what they thought to sit down and discuss with the minister. And what did come out was there are problems, there are issues that needed to be sorted out if the aim of that palliative is to be met. It was obvious that there are some issues, especially with the homegrown feeding program, which the minister admitted herself that there are issues that needed to be sorted out. There is also the need to, broaden the register of the indigent in the country if we are going to make that program, which she said a meeting is already in progress with the World Bank to that respect. What also came out, Lydia, I must tell you, is that she admitted that the federal government is yet to pay its own part of the counterpart funding, saying that what is being used at the moment is the loan from the World Bank. So these are issues, but ultimately my take is that this meeting is one that would look at the best way possible so that every kobo that is coming out of this economy that is badly affected by COVID-19 goes to the targeted people and makes the impact that we all desire that it makes.
Now, of course, all of this is related to the measures put in place to address some of the fallout of COVID-19 and its impact on the vulnerable and the poor, the school feeding program and all that. So going forward now, what do you see that could possibly happen tomorrow in terms of, do you hear anything in terms of what is going to happen in terms of palliatives and what could be distributed to people following the president's orders over the last week?
Well, no. Before now, I assume the ministry has its programs listed where it will be going to do what. But with this meeting, which of course the better part of it was behind closed doors, I suppose perhaps if there is anything at all, perhaps it will be on hold for a bit until they tidy up whatever loose ends that there are, because the Senate President was particular. He wants to know, going forward, what are the modalities, what methods are they going to put in place to ensure that what is being distributed gets to the people it is targeted at. So perhaps I'm just saying, that might delay it for a bit until they sort that bit out. But if they were able to discuss and reach an agreement at the meeting, which we don't know of at the moment, then it will probably continue. But right now, I don't have a register or an idea where they'll be going for the next distribution. Ladi.
Right then, thank you very much, Ibrahim Adra. It's been a pleasure with discussing with you. Our correspondent, Ibrahim Adra, joining us from our Abuja studios. We'll take a break, and when we return, we'll take updates from a number of other locations. Of course, plus more discussion, so please stay on with us.